All right, well, good morning, everybody. Thank you for joining us here today. We've got some really exciting programs we're going to be talking about. Unfortunately, we don't have a sign language interpreter here today because none of them, our regular folks, were available. But I do appreciate everybody showing up. We've got a great crew that we're going to be talking about, which is how we improve healthcare here in our state. So I'm being joined by Jeff Stafford, who is the CEO of United Healthcare Community Plan in Nebraska. We got Kevin Bagley, who is our Director for Medicaid and Long-Term Care. Ashley Aubrey, who's a public health hygienist at the School of Dentistry at Creighton University, and she is going to be representing the Healthy Smiles, not Happy Smiles, Healthy Smiles program. I knew Happy Smile wasn't right. Healthy, though maybe you should consider that. That's a happy thing too. Healthy Smiles program. And then we've also got Dr. Maureen Turney, who is the Associate Dean and Chair of Clinical Research and Public Health at Creighton University. And then last but not least, Mike Hornacek, who's the CEO of Together. And we're going to be talking about how we're improving healthcare here in our community. The mission for the Department of Health and Human Services is help Nebraskans live better lives. And one of the ways we're doing that is figuring out how we can be more preventative, more proactive with helping people to be able to be healthy. So we know, especially in underserved communities, it can be a challenge, for example, if you don't have a family physician or a family doctor that is helping you out on a regular basis, right? Primary care doc. Or maybe you need education on eating healthy foods, or just health literacy in general. What can we do to reach out to folks to help be more proactive? And how can we use some of our Medicaid dollars to invest in those innovative programs? And so that's what Kevin Bagley is going to be talking about, is how we use our Medicaid dollars to invest in those different type of innovative programs. And then, of course, the other folks up here are really representing those innovative programs and how we're reaching out to communities, especially underserved communities where people may not have that easy access to health care. They may need some help with regard to healthy food options or education on health literacy. So it's going to be a really great group here of folks who are going to talk about that. We're going to start with talking about what United Healthcare is doing. So Jeff, I'm going to ask you to come up here and kick us off.
Thank you. First of all, thank you everyone for coming, and I would especially like to thank the governor for having us here and Director Bagley. We've been serving Medicaid members in Nebraska with United Healthcare for a couple of decades now, and we are seeing the need for systemic support around things that influence the health and welfare of Medicaid members. And we know that sometimes access to funding can be a barrier there. And so our effort has been to develop partnerships to help overcome those obstacles. We can each play our part and accomplish more together. So I appreciate the state of Nebraska's leadership in bringing government, for-profit, nonprofit, and academia together to work together to get more done for our communities with the same amount of people and resources that we have. And I think that is one of the things I'm most enthusiastic about with this whole topic. It's at the core of our mission with United Healthcare to make sure that Nebraskans have access through innovative programs or partnerships, the care they need and the basics that they need, access to food and shelter, to eliminate disparities and make sure that people have equal opportunities to thrive and live healthier lives here in Nebraska. So today I'm honored to announce formally here something that we've been working on, and that's a $5.4 million investment in the Creighton Community Collaborative over multiple years. And this is aimed primarily at helping communities in North and South Omaha and making sure that we learn from that and learn better ways to apply some of these same solutions to communities all across the state of Nebraska. We want to be able to promote health equity and wellness instead of just paying for fixing folks once they reach a critical state. So this is a much better way to go. We approached Creighton University for this partnership. Creighton is one of our key academic partners and has the capability to help us design methodologies to address the most impactful social determinants of health and social needs that people have. We look forward to working, as we have been over time, with Dr. Turney and her team to collect data and insights that we will use to find the things that work and replicate those, and to pivot where we need to on things that didn't get the results that we want. This program is part of an ongoing commitment for United Healthcare for the most vulnerable in our communities. We are honored to be participating in the Medicaid program here. It is our mission. We are passionate about it, and we think that this is a great extension of that. We also, I should point out, work with partners that are not here with us today, but have been part of this effort. And what is fantastic is the way that people both inside and outside the collaborative that we have put together will collaborate with a fundamental sense of decency that is just seems to be intrinsic to the state of Nebraska and Nebraskans. So, for instance, the University of Nebraska's College of Public Health, the public health departments across the state, and many nonprofit organizations that aren't specifically into this initiative have also been very helpful, and we appreciate that. We've seen great results from having folks work together one with the other, improving vaccination rates, improving access to food and services as well while we're working it. Additionally, we have a collaboration with Activate Care and their partners, NOMI, that are in the audience with us today. We are working to study how we can improve the delivery and the feet-on-the-ground approach that we are seeing the needs develop for through our program. That'll be based in Douglas County, and will also help us work on health equity and our strategies there. So I thank everyone here for their attention to this topic. This is about making Nebraska just a little bit better than it is already, a place to live, which is an outstanding initiative. And I would like to pass it to the director of our Medicaid and Long-Term Care Division, Director Kevin Bagley, who is a fantastic Medicaid director, tough, forward-thinking, and I'd like to clear the way for him, so in case we'll be in trouble for anything later, I'm going to make sure that, thank you very much.
Thanks, Jeff. I think. The old adage is that it takes a village, right? And I think what you're seeing here today is part of that village, part of that wonderful community of stakeholders that comes together to make a difference for the people of the state of Nebraska. We live in a wonderful state where people are giving, people are thoughtful, and people want to make a difference. Governor Ricketts mentioned the mission for the Department of Health and Human Services, which is to help people live better lives. This is one of several initiatives that we as a department are undertaking in collaboration with our community stakeholders and partners to help people do that. We know from experience and from academic research that part of what helps people live healthier lives and better lives is access to those social needs. Those social needs drive people's health, whether it's access to transportation or food or housing or education or employment. All of those things make a big difference and allow people to access better the services that they need. One of the things that I love about our Medicaid program here in the state of Nebraska is that we have an opportunity to add tremendous value to the community. While we're here talking about this particular initiative, there are other initiatives, as Jeff mentioned, that are taking place not just with our partners at United Healthcare, but with our other managed care plans as well. Tens of millions of dollars are invested every year by our partners in our health plans to address needs in the community that are outside of the typical healthcare delivery that we might otherwise see, where we're treating an illness, which is obviously important. But this and other similar opportunities and investments in the community are one of the ways that we really make a substantive difference in the lives of the people we serve. It's a privilege to be able to serve in that capacity and to be able to be a part of those programs. We recognize the value that bringing the community together has. None of us on our own can make the type of difference that these initiatives make. But all of us bring something to the table. And so by taking part in these initiatives, making these investments, being forward-thinking about where people are going to have those needs in the future, and then starting to build an apparatus through which we can really assess those needs and measure our value that we bring to the community is going to be something that makes a big difference. It's going to be something that will help bring us all together. It'll be something that helps the people we serve live better lives. And that's the point of these programs. It's not just to treat illness. It's to really make our community a better place and to add value. So I'm excited to be here today with all of these wonderful partners, and I'm excited to be able to continue to work with them and make a difference in the lives of the people we serve. So at this point, I'm going to pass it off to Dr. Maureen Tierney. She's the Associate Dean and Chair of Clinical Research for Public Health at Creighton University. So, Dr. Tierney.
Thank you. Thank you, Governor Ricketts, Commissioner Bagley, members of the press. I am thrilled to be here because I am extremely enthusiastic about the Creighton Community Collaborative, which was developed to steward and guide the reinvestment of UHC MCO funds to address the major SDOH, or social determinants of health, primarily housing insecurity, food insecurity, access to primary care, and vaccination, particularly COVID rates. So we pulled together a steering committee at Creighton that includes representatives from all the schools: medicine, law, dentistry, arts and sciences, business, to help with representatives from UHC and the Douglas County Health Department. And what we do is develop and together make decisions on which community-based organizations that are ongoing would get partial support from some of this funding, or to help to create new programs from community-based organizations or from Creighton-based programs to try and address SDOH. There's actually 15 in all during this calendar year. And what we've endeavored to do is to measure the success of each program so we know if it's working, how we need to change it, by examining two things: the referral patterns to social services through platforms like Unite Us, Find Help, Activate Care, Innovaser, for all of the projects. And then we define outcomes tailored to the specific projects so we can determine whether or not the interventions have actually been successful. So I'd like to give you a few examples of that. I can't talk about all 15 programs, and you're going to hear from Mike Kornichek and from Ashley Aubrey about their programs in greater detail. But just to give you a few other examples, Nebraska Family Works program, which is part of Heartland Family Services, is an addiction recovery program that focuses on the whole family. The CCC, Creighton Community Collaborative, funds about 12% of this program, and so far this year, they've had 128 attendees. 88% of their clients leave the program in stable and drug-free in recovery. 100% of them report decrease in mental health symptoms, and 100% of them actually receive new essential parenting skills. One other project is the Cura Diabetes Project. Now, this is based at the Creighton Highlander in North Omaha. And it's an 18-month program that hopes to improve outcomes in individuals with type 2 diabetes by providing their standard medical care, but on top of that, providing intensive lifestyle and health coaching, a financial management support program, and access to a food pharmacy. They've already enrolled 71 individuals, and they're going to actually go through a process of pre- and post-testing, surveys on their financial health, looking at hemoglobin A1C, looking at lipid levels, and prior pilot tests of this program actually showed a 2-point drop in A1C, a decrease in smoking, and a 20% improvement in income. So we are really looking forward to that program having significant results. A few other programs to note are No More Empty Pots, who are engaging with the Black doulas to assist pregnant and birthing mothers with nutrition education and increase access to fresh produce. And then Food Bank of the Heartland, which we all know. And what this program was actually able to do is purchase a commercial refrigerated truck because there was a number of people, particularly with rising gas prices, who couldn't get to Food Bank for the Heartland. And we anticipate that 24 million pounds of food will now be delivered to people who couldn't get there. So in the coming months, we will continue to measure the success of these efforts so that we can ensure that they are being directed in the most impactful way. So now I'd like to turn it over to Mike Hornacek, the CEO of Together, Inc. They are also one of the recipients of some of the funds from this project, and Mike has some wonderful things to share. So thank you.
Thank you, Dr. Tierney, and thank you, Governor, for the opportunity to be here. Good morning. My name is Mike Hornacek. I'm the CEO and president for Together. We're an Omaha-based nonprofit that has served our community for the past 47 years to address food insecurity and homelessness. I would like to start this morning by sharing my gratitude for the opportunity to speak today and for the support of the amazing work being done through this innovative and collaborative project. Thank you to all of you. As we have heard today, food insecurity and safe and affordable housing are two of the strongest determinants of improving public health for our most vulnerable neighbors. Together provides access to healthy and nutritious food through its Choice Pantry to approximately 43,000 unique individuals each and every year, and that number continues to grow, unfortunately. Together also provides access to affordable and safe housing through its rapid rehousing and crisis engagement programs. To date, in 2022, the rapid rehousing program has placed 66 households in safe and affordable housing, with 0 returning to the homeless services system within the last 24 months. The crisis engagement program received approximately 7,200 phone calls, resulting in 2,510 households retaining or attaining safe and affordable housing. Another 350 received IDs and birth certificates to help attain housing, education, and employment. The financial investment from United Healthcare Community Plan and Medicaid has allowed Together to build capacity in its existing programs and launch innovative new programs targeted at ensuring our most vulnerable neighbors have access to healthy and nutritious food and safe and affordable housing. In addition, Together launched an in-reach program that intentionally and compassionately works with our local shelters to prepare and remove any barriers present to households attaining housing. This could be providing an ID or a security deposit, first month's rent, housing search assistance. Additionally, the investment supported the growth of a home delivery program that ensures access to healthy and nutritious food for those with chronic health conditions. Stephanie is a perfect example of this. Stephanie was staying at a local shelter after long episodes of homelessness due to trauma and abuse when she met Destiny. Destiny provided life and coping skills while working with Stephanie on finding a home and employment. This past August, with Destiny's help, Stephanie found a job at Home Depot, enrolled for classes at Metropolitan Community College, and found an apartment. It has been about 3 months, and Stephanie is living independently, getting the medical and behavioral health care she needs, and ready to be discharged from the program. Stephanie is not here, obviously, but I would like to say congratulations to Stephanie for her hard work and her perseverance. This innovative approach, bringing organizations together from multiple different sectors, is a perfect example of how we need to work moving forward to find impactful solutions to food and housing security in order to improve the collective public health, reducing the levels of obesity, diabetes, and lead poisoning in our communities. A healthy community lowers healthcare and hospitalization costs, improves educational attainment, and has a stronger, more resilient workforce. Thank you again for your time today, and I would like to pass it on to Ashley Aubrey with the Creighton University School of Dentistry Healthy Smiles Program.
Good morning, everyone, and thank you all for having me today. My name is Ashley Aubrey. I'm a public health hygienist for the state of Nebraska and the assistant professor for the Healthy Smiles Dental Sealant Program. Healthy Smiles is a dental-based program that addresses oral health disparities among the vulnerable and oral health disparities in Omaha metro area. Creighton dental and nursing students provide care to 12 Omaha public schools, 1 Papillion La Vista school, and 2 private schools throughout the area. We provide services such as dental screenings, fluoride varnishes, oral health education, as well as case management to address some of those needs. We work professionally and collaboratively with our nursing school to help provide care and show our new professionals that they can work and treat the whole patient, just as Creighton represents Cura Personalis. When our program finds any child with any urgent dental needs, we work extensively to help them gain access to dental care. Whether we work against barriers such as financial, transportation, guardianship, and even access to dental care, we help those children find the best office that works for them. We see approximately 2,500 children throughout the year, and we case manage over 400 kids that need dental need. Just this week alone, 3 children needed emergency room care at Children's Hospital, provided care for dental pain. Those children going into the holidays now will be able to be pain-free. With the help of United Healthcare and Medicaid funding, not only are we able to sustain our current program, but we're able to expand. We now have an adult assistance program that helps our families, not only those children, but those parents. We've also been able to gain more support with another public health hygienist, 2 liaisons that have parent supporting systems, and we are able to provide more Blue Jay Buck program and Uber transportation for those families. We currently have 6 children from last year alone that need operating room care at Children's Hospital that need financial assistance. But I don't want to leave today on that negative note. I'd like to end with a very positive and heartwarming story. A couple years ago, we were in an elementary school, and a little one presented with a toothache. That dental student walks up to me and states, "I'm having a hard time with the language barrier being able to get her to open." We walk over, we work with that little one, she opens, and in fact, has 2 teeth on each side that need extensive work. I immediately walk into that nurse's office, which I educate our nursing students that this could be them as well, advocating for these families, and we were able to connect with that family via the language lines and make them an appointment the very next day to have those treatment done. A couple days go by in that school, and the little one's walking down the hallway, and I think to myself, she's probably not gonna look at me, let alone talk with me. But in fact, that little one got out of line, walked over to me, showed me her teeth, and gave me the biggest hug. I wish I could go back in time and tell that dental student that I understand that this is a 4-hour required course that they must obtain to complete the course, but they changed that child's life. That child is no longer in dental pain and is able to actively go to school without the need for dental. So as I sit here and educate my dental students and the nursing students how the importance of oral health truly is, we are truly making a difference in the state of Nebraska. And I could not do that without the continued support of everyone around me, as well as my colleagues at Creighton University. And I thank you so much for your time. I could stand here probably for hours and talk about dental public health, but I know our time is valuable. So thank you again. I appreciate it.
Great, thank you very much, Ashley. Great story, and again, great results from everybody. Thank you so much for all your work you're doing. Very impressive what you're doing. And I think that, again, one of the things I'd analogize this to is also what we're doing in children and family services, where we have Bring Up Nebraska to organize the community services around people to, again, be preventative. And you heard here what a great job all these folks are doing with these innovative programs. So very excited to be able to talk about that today. Next, I'm going to do just a quick brief on what happened with regard to our trade mission, just kind of cover some of the highlights there, and then we'll open up to questions and answers on this topic. We'll then do topics on the trade mission, and then as we have time, we'll do other topics as well. So with regard to the trade mission, I led a delegation last week to Japan, and of course, we have not been able to visit Japan because of the pandemic for the last really almost 3 years now. And folks were very excited to see us because they haven't had a lot of visitors. They just opened up their visa system. We didn't have they required a visa up until October 11th. So as soon as that requirement was released, we were able to organize a trip and get over there. We took the Nebraska Farm Bureau, a number of our Nebraska producers representing pork, ethanol, and so forth, and had a lot of great meetings with different companies over there that are working with Nebraska-based companies. So for example, Mitsubishi Heavy Industries is invested in Monolith Materials. We met with them. Nippon Steel has a brand called, about 20% of their business is actually food, and they have a brand called Nebraska, or Captain Beef, which is focusing on beef from Nebraska. So they're really branding Captain Beef as beef from Nebraska. And so we talked with them about how we can help them and saw some of the work they're doing in their grocery stores there to promote beef, take-home beef. Actually, turns out the Japanese don't actually cook hamburgers at home. They buy them in restaurants, but they don't do it at home, so we're trying to expand that marketplace there. Met with folks from Prima Ham and Holstone Farms here in Nebraska, talk about what we could do there. Toho Cinemas is buying Preferred Popcorn. In fact, Preferred Popcorn has a huge percentage of the marketplace in Japan. Of course, Nebraska is the #1 popcorn state, and Preferred Popcorn has a dominant position there in that market for popcorn cinema. So a lot of great places where we are working with people to try and make those connections and see what additional opportunities would be available. And when we go to these trade missions, it really helps develop those relationships. We can see, for example, beef sales to Japan are up 88% since 2015. That's $215 million. So that's one example of one product in one country. 56% of all the pork in Nebraska goes to Japan. So these are important relationships to develop. We also talk to folks with a lot of interest in sustainable aviation fuel made from our ethanol. So potential new products that will be coming down the road that is of very interest to the Japanese marketplace. And then, of course, we met with the Ministry of Foreign Affairs and the Ministry of Economy, Trade, and Industry as well to talk about some of the great things we're doing here in Nebraska. So I want to thank all the folks who went along on the trade mission. Our producers are our best ambassadors. People are surprised to hear that 95% of our farms are family-owned, and that's a story that we need to continue to tell because people want to know where their food is coming from. And we produce the highest quality products here in Nebraska, and it's because of our family farms and ranches. So it was a great trade mission. Really was pleased with the outcome and want to thank the Department of Agriculture and the Department of Economic Development for planning it. They were also along on the mission and did a great job. Also want to thank the embassy there as well. They were very helpful. And in fact, one of the things they said is when delegations come over, it really helps them to maintain the relationships that they have with folks in Japan. So that was a great thing. Having wrapped that quick brief up, what I'd like to do now is open up to questions and answers on the topic of the innovative programs we've got going with Medicaid, United Healthcare, and the Creighton collaboration here. So we'll take questions on that first. Martha.
So if I understand this correctly, what this is you have United Healthcare providing funding for these various programs that are doing each their own piece of this project.
Yeah, so Kevin, I'm going to maybe ask you, so Martha's question is about the funding. So obviously Medicaid is involved in the funding as well, okay? So, but it is how United Healthcare is taking those Medicaid dollars and investing in some of these programs that are really innovative. And so Kevin, I'm going to ask you to go into more detail.
Sure. So as part of our Medicaid contracts with our managed care entities, They are obligated to spend about 85% or greater of their revenue on services to the community. Generally, that takes the form of actual reimbursement for medical services, for treatment. But it can also take the form of these type of community initiatives that improve the health of the community. And so this is one of those investments that United Healthcare is making with dollars that are available to them through the Medicaid program.
Do the other MCOs have similar initiatives where they're also putting out millions of dollars?
They do,
So,
yes.
Repeat the question.
So, thank you. So the question was, do our other managed care entities also have these type of initiatives? The answer is yes. We estimate that we probably spend somewhere between $40 and $50 million a year on these type of initiatives for the community.
You know, and another point I just want to emphasize is that when you have programs like this that are being preventative, in the long run, that is going to create better health outcomes for folks rather than waiting until, for example, they go to an emergency room. You know, you can think like having a primary care doctor is important. And if you don't have that, you're going to get health outcomes that are not going to be as good as they could be. It's kind of like if you don't have a checking account, you're not going to have as good of financial outcomes as far as managing your finances. So we want people to have that connection, to, for example, to primary health needs. Or Mike talked about housing. I mean, talk about a basic thing that is going to improve your health outcome, having appropriate housing or options for healthy food. Those are all the sorts of things we can do that will help people be healthier and will be better for everybody in the long run. Yeah, please, Maureen, yeah.
I just wanted to raise one additional point, is that I think one of the reasons that Jeff wanted to partner with us is also because we have the capacity to try and measure the outcome. So a lot of the times when you're doing programs like this, there's always the great intent to do good by addressing social determinants of health. But if you don't actually measure whether or not you're being successful, then you don't know whether that program, that there's the impact it needs to have, or what you could do to make greater impact. And I think that's what the team at Creighton is actually providing, particularly in this situation. Thank you.
How much, who gave money straight back to, payments, if you did this, what's the, I guess, what's the.
Kevin, that sounds like a you question. To make sure you repeat it.
So if I understand right, the question is, what portion of total payments does this type of investment represent?
Like, say, because you're being preventative, how much money do you save long run? I think is
Yeah,
what I'm saying.
which way does the dollar go farther? When you're looking at this, either paying the bills or paying money to prevent.
So, okay, so kind of what is the kind of potential savings associated with these type of preventative care? So I'll say, I think the research is out on that. I think the old adage that an ounce of prevention is worth a pound of cure is probably accurate. But I think part of what we hope to accomplish with these initiatives is to start measuring the value that we bring. I think it's difficult at this point to say what would services be in the future, and then comparing what we think they would be to what they end up being. But our hope is that we actually have a really solid foundation and framework within which to measure the value as we work with Creighton.
Paul, I think-
So just to help me understand what's new here, is that they're working with Creighton and they're able to study whether these things are working or not?
Yeah, so Paul's question is, what's new here with regard to working with Creighton and so forth? So,
Yeah, so part of it is our work with Creighton here and kind of this particular collaborative. I think what's also new is the drive to measure the specific impacts and the drive to ensure that we understand what success looks like. I think anecdotally, I can say that Medicaid adds a tremendous amount of value to the community. And I think most people who have experienced working with these type of programs would agree, but I'd like to be able to talk about what that value is and quantify that and be able to really understand as we progress into the future, are we creating more value? And that's part of what's unique here is the ability to really dig in and measure that.
Jeff, did you want to add anything to that? Sure.
Yeah, so let me come back to what's different and maybe a little bit on what's the trade-off on value. So one of the things that's happening across the United States that is different is we are realizing in this Medicaid and healthcare space that Maslow had it right. If you're trying to get someone to keep their health conditions under control and managed, but they don't have access to food or shelter, they're not focused on those things. And that means that, for instance, with Medicaid programs, the taxpayers are going to have to fund more hospital stays, more specialists, more doctor visits. Now, we are thrilled to be working with our hospitals, doctors, and specialists, but the ounce of prevention, pound of cure thing is absolute. Now, on the trade-offs, the initiatives across the United States on social care and social determinants of health, there's very little yet that has provided the actual trade-offs. However, I would say that one of the things that attracted our attention was that Creighton had on one of their programs, the Financial Hope Collaborative, that was tucked in there as a little piece, some of the first peer-reviewed research right here in Nebraska that's available out there. And so, and everyone that has looked at it has found the valuable trade-off. We know that we're going to have the patience and the discipline to do this for a little while, because turning that corner on a population level takes a little bit of time. So we believe that this will be a multi-year thing, but we know that if we wait until people need acute care, it's very expensive. And when we can do prevention, it almost always has proven to be a better use of funds for the taxpayer. And so we're building our capability to do more prevention, and that's what's new and different, involving social care. It's pretty exciting, and frankly, it's great that Nebraska's being a leader in this space for its citizens.
Yeah, Martha.
So, two questions. Are these projects, like with Together and with Healthy Smiles, are they new because of this money, or is this a project that has been going on and this is just helping you fund what you've been doing? The second question is whether this is entirely focused on Omaha.
So Martha has two questions. One is the program with Healthy Smiles and Together, the dollars coming in, is this new, so they're starting up, or is it helping add on to what they were already doing? And two, is this just focused in Omaha? And so, I don't know, I think I heard you say, Ashley, is that this was helping you expand what you were already doing, is that right? So Healthy Smiles was already doing this program. This helped them add another hygienist, right?
Correct, and two other liaisons.
And two other liaisons as well, so expanding what they were doing. And then, Mike, you've been around for a long time, so,
So both. It
Yeah.
helped us expand existing programs, and we launched the home delivery program and the InReach program.
Todd, why don't you just come up here and say that? Yeah. Say it to the microphone.
So it did both. So we used the funding to expand some of our current housing and food insecurity programs just because of the severe need we had seen during the pandemic and continue to see. And then the funding also provided the opportunity for us to start two new programs in response to the continuing need that we saw. One of those, like I said, was around the home delivery program, and the other one is designed around InReach into the local shelters in Omaha.
Yeah, please, go ahead.
So again, everybody's answer is both. There are some programs that it's just adding to the established program, some where it's creating new programs within established program, and then there are some new programs. So one additional new program that I think is really exciting is Creighton psychiatry residents are actually 1/2 day a week staying or being in the office at Omaha Housing Authority. And there are a number of individuals who probably would go to eviction or would be kicked out, et cetera, because of their mental health issues. And by having this capacity to immediately be seen by a psychiatrist and have some of them get referred into mental health, it's taking care of the mental health and it's preventing eviction, so it's creating housing insecurity. So that's an idea, that was a totally new program. So it's a combination of sort of all three.
And then do you want to talk?
For our Healthy Smiles program, not only did it help sustain our current program, which helped with our Blue Jay Buck program, was any child can come to Creighton who's uninsured, can come for $10 an appointment, as well as our transportation. A lot of these children do not have a mode of transportation, so we're able to call that transportation piece to get them access to dental care. The expansion helped us with our adult assistance program. A lot of our families, the parents as well, have a toothache or need expensive care. So that helped us to open up that care and provide those services not only to Creighton, but to other outside entities to get them better access to dental care. Our new public health hygienist, she is also out there with me, actually taking the place for me today to be here, to still see those children. We'll probably see on average 50 to 60 kids a day with dental screenings, and among them, we're probably walking out with 10 kids with urgent dental needs. So alone, this expansion has helped us grow so we can be more places at once and get in to serve our community in a better, much more efficient capacity.
When do you guys want to address the Omaha versus outside Omaha?
Yeah, go ahead. So I'm going to address the Omaha or where else, and I'm going to do that by referring back to your last question and taking it from there. One of the, all of the great things that were happening and the people you see up here and the other people that have been mentioned, they've been great people and they've been doing great things before this came along. But as we look forward, one of the magic pieces that comes out of this is we won't be doing those things separately, right? So by doing it in this program, we're building the ability to coordinate our care notes and our case management. So if a person walks into a shelter and they need help, they can also get referred to a food pantry. They can also get referred to how to access their Medicaid benefits, and we can get them scheduled for preventative health right away, then again, saving, future often neglected healthcare needs. So by working together specifically, we're doing more today, but we're building the capability to be a team, and to be a team using data and processes and communications that are, robust to serve the need. So that is the reason that we're starting in Omaha now. We picked North and South Omaha because we had good medical partners to work with. There's two very strong federally qualified health centers that support Medicaid, and they have the openness and the capacity to participate with things like this. We had the community organizations. We had Creighton right there. So it's North and South Omaha right now because what we need to do is to remain focused and disciplined enough to build not only some benefits and expansions today, but to build the connective tissue that makes us a better team for the Medicaid programs, for the community programs, and for providers and our academic institutions as well. So we will be going other places, and we do programs in other places, but we focused this one in Omaha so that we could have enough density, gravity to also build the teamwork with one another so that we come out of this not just with, okay, we helped some people and we expanded some things, but that next year, the year after that, the year after that, and so on, we're able to better take care of our citizens and then take those learnings and use them in other communities across the state. So it wouldn't be a one-size-fits-all, but yes, we do plan to take it further. We started in one place, and we're going to get our outcomes and our game strong there. Thank you.
All right. Any other questions on this topic? All right, seeing none, I'll go ahead and excuse our guests, but thank you all again for being here today. I really appreciate you coming out and telling the story about the great work you're doing. Very impressive so far. I look forward to seeing how you continue to work forward and collaborate. And again, Kevin, great job. Thanks, everybody.
Thank you.
All right, so next we'll go on to questions about the trade mission. Does anybody have any questions about the trade mission? Yes, Paul.
Do you obtain any commitments for additional purchases of beef or corn, or just more about just maintaining relationships and making sure that's
So the question Paul asked is, did we obtain any more commitments about purchasing additional beef, or was it more about maintaining relationships? A lot of it was just going back and thanking current customers. However, I will point out that we were the first trade delegation to go there after the Japanese upper house in the Diet approved a new beef tariff that will make it more difficult for our producers to trigger a higher tariff. So I expect that because of the reform that the folks and the federal government have done to work with the Japanese government to make it harder for us to hit that tripwire and get a higher tariff, we should sell more beef and be more competitive against the Australian beef. Right now, the U.S. beef and the Australian beef are each about 25% of the marketplace, and I expect that since we won't be having these higher tariffs going down the road, we should be able to expand that market. Yeah, Andrew.
In the big picture of what you're seeing in the Asian trade, I mean, how important is this to establish your relationship with Japan, especially when you're looking at what's going on in China?
Yeah, so the question was, in the overall big picture of Asian trade, how important is it to make sure we have good, strong relationships with Japan? Absolutely. You know, certainly one of the things we've seen over the course of the last couple of years with COVID, and it's still ongoing in China right now, is the disruption in supply chains. China has a zero COVID policy that is enforcing strict lockdowns, and that has disrupted supply chains. And so when you can go to Japan, who not only is an opportunity for us to have supply chains, but invest heavily in our state. They're the number one, international company that invests in Nebraska, creating about 5,800 jobs. We want to make sure we've got good relationships to be able to get those investments, and then also work with those Japanese companies that are looking to expand their supply chains to other countries as well. So I think this is, again, it's a win-win. It's a win for us here. It's a win for the folks in Japan. And again, at the end of the day, it's all about relationships. People, do trade based on relationships, and so you have to be present to be able to establish those relationships. Jordan, or is there anything else that you would add to that? Yeah, excuse me. I'm going to invite the man who put together this, Jordan Schlake. Please come up and give us a briefing.
Morning, everyone. Jordan Schlake, Nebraska Department of Agriculture. To your question about, the importance of Japan, given the development in China and the larger Asian region, something to remember about Japan is they really value quality in food, much more than anyone else in the region. So, yes, while beef exports and all these other things are growing to China, the demand for high-quality beef is strongest and will remain strongest for quite some time in Japan. And so, Nebraska, we pride ourselves on our high-quality beef. We have, the producers and the science to back that up. And so that's why we really target Japan, because while China might be buying more, they'll probably start off buying lower quality beef. And so that gives us more room to grow our market share in Japan and benefit producers around the state.
Thank you, Jordan. Any other questions about the trade mission? Okay, seeing none. Thank you again, Jordan. I appreciate it. Jordan came in on his day off to be able to answer questions, so thank you, Jordan. Questions on other topics? Yeah.
This morning you announced your intention to run for the U.S. Senate. Can you talk about why you came to this decision and what you hope to accomplish?
Well, the question was, I announced today that I'll be one of the applicants for the U.S. Senate seat, that Governor-elect Pillen has announced his process, or at least a portal to be able to apply. And the question is, why do I want to do this? I think this is, one of the things, obviously I'm being term limited out here as the governor of Nebraska. I love this state, and I'd love to look for additional ways to be able to help the people of Nebraska, and this may be one of those opportunities. Paul.
There was a critical opinion piece in the World-Herald the other day from Jeremy Aspen. He said, well, politicians shouldn't get these kind of positions by appointment. They should be elected. Can you respond to that? Jeremy Aspen.
So Paul's saying, there was a opinion piece in the World-Herald that, people shouldn't get these positions by appointment, they should be elected. And in fact, that's the process with the Senate seats and the congressional seat. We obviously just went through a special election with the congressional seat. We did that in June. The rules for the Senate are a little bit different. The person who would get this appointment would stand for a special election in 2024 and then have to run for the full seat in 2026. So I think that with regard to that opinion piece, that is the process, and we certainly, for example, don't want to have an open Senate seat for 2 years till the next general election. So I do think that that's the process the Senate has chosen, and there is a special election that will be coming up.
Did you consider waiting till 2026 and just running for the position?
So, again, I was looking for an opportunity to be able, the question was, did I consider waiting for 2026? I said, I'm just looking for an opportunity to be able to help Nebraskans, and so I'll apply like the other applicants. Yeah.
Governor, you spent $1.5 million of your own money in a campaign to help Jim Pillen get elected. What's your response to people who say it looks like you're trying to buy the U.S. Senate seat?
So Paul's asking, hey, I've obviously supported Jim Pillen, not only endorsing him, but financially, and so I will make my case for why I think I'm the best applicant when I have a chance to talk to Governor-elect Pillen about it. Yeah, Andrew.
What tipped your decision to want to run, or to want to serve, I guess, before you were saying that you had made up your decision?
So, Andrew's asking, what tipped my decision to run? I was waiting for the process to see what Governor-elect Pillen was doing, and then when he announced his process yesterday, said that I would be one of the applicants for the position.
So you knew you were going to run all along?
Well, I wanted to see what Governor-elect Pillen was going to do. It's going to be his decision, and I wanted to see his process.
Did you have to disrupt any plans to apply for this, or at least be prepared to take the post if you were appointed?
So Paul's asking the question, are any plans going to be disrupted with regard to if I'm the successful applicant here and get the position? Certainly that's going to change some of the plans. I was not, planning on taking this seat so early, before Senator Sass announced in October that he was going to be resigning at some point. But, we'll see. I've still got to be an applicant, and, we'll take it one step at a time.
One more question?
One more question.
When did you find out that Senator Sass was considering leaving and becoming president of the University of Florida? Was it before October?
So the question was, when did I find out that Senator Sass was going to be considered for the job at the University of Florida? Senator Sass called me on October 6th, just a few hours before the public announcement went out, to give me a heads up that it was going to be coming out.
So this is not all a cooked up Wendell Anderson scheme?
I found out just a few hours before the general public that Senator Sass was going to be considered for this job.
Can you comment on, some people think this is a done deal since you're political allies with Governor-elect Pillen?
Paul's saying some people think this is a done deal since, Governor-elect Pillen and I have been friends for nearly 20 years. Again, I'm going to be an applicant like anybody else. I'm going to apply, and we'll go through Governor-elect Pillen's process. Well, again, folks, thanks very much for being here today. I appreciate it. We got some great work that's going on in the Department of Health and Human Services. Again, Department of Ag and Department of Economic Development did a great job on our trade mission. We're continuing to expand those opportunities as well, and I hope that you all have a great rest of your week. Thanks.